Hi, I'm Dr. Khiet Trinh. Today, we're going to spend some time demystifying inpatient status. What's inpatient? What's outpatient? Let's explore. Patient status is one of the most confused and misunderstood processes during a patient stay. Aside from the financial implications, there are true legal implications. Every payer has their own set of rules to determine what's inpatient and what's outpatient. With Medicare, if they're a traditional patient, we use the 2 midnight rule. For commercial payers, some may use MCG, some may use interqual, and some even use their own proprietary criteria. So first, who is the payer? We love the 2 midnight rule for its simplicity. The rule states if there is an expectation that the patient will receive hospital level of care that will cross 2 midnights, that patient should be inpatient. However, there are some situations where a patient may not stay 2 midnights and could still qualify as inpatient. So there are commercially available screening tools, the 2 largest being interqual and MCG. And per payer contract, it's important that you determine which tool the payer wishes to use to help determine status criteria for their members. The patient mainly is affected when there is a financial difference. So here, for example, a traditional Medicare who's inpatient, they have different deductibles, they may have different co-insurances, and if they are outpatient status, they have co-pays each time. They have to pay for the self-administered medications. Financial impact will also include being an inpatient allows you SNF coverage, it allows you to appeal discharges, quality of care. The clinical care given to a patient, whether they are inpatient or outpatient, should be the same. If the patient is still in the hospital and it is a concurrent denial, our first step is to just really get on the phone with the medical director of the payer and explain our perspective, listen to their perspective, and hopefully come to an agreement. This is called a peer-to-peer. Now, if the patient has been discharged home or the peer-to-peer fails, we will often write an appeal letter. As the name implies, it will be a written response to a denial. We will highlight why we feel the patient met inpatient. In particular, what's very effective is to cut and paste the subset of whichever screening tool that they agree to, whether it's MCG or interqual. I will cut and paste the subset, explain how the patient meets their subset, and why that should compel them to approve the inpatient stay. We as physician advisors feel very strongly compliance and protecting inpatient rights are at the core of what we do.